This whole scene takes place at old Mr. Bladderson's house, where some of the local kids have gotten their pogo ball stuck in his upstairs planter box. Just inside the window, we see one of Mr. Bladderson's numerous pet crabs in a cystic-looking fishbowl. Yep, that's bladder cancer. For the first segment of this sketch, we'll illustrate the two most common types of bladder cancer: urothelial carcinoma, also called transitional cell carcinoma, and squamous cell carcinoma. Let's start with urothelial cell carcinoma. Urothelial cell carcinoma is the most common bladder cancer in the US and Europe. The urothelium is the epithelium that lines the renal pelvis, ureters, bladder, and superior urethra. It's also called transitional epithelium because it's a stratified epithelium in which the shape of the surface cells change depending on the degree of stretch. It undergoes transitions, in other words, depending on how distended the bladder is. Think of the urothelium as the curtain with a stratified cellular design. Stretch it and the shape of the cells change. Urothelial cell carcinoma can occur wherever there's urothelium, as highlighted by this bladder-shaped shell, with what looks like two ureter stems sticking out. Got some kind of renal pelvis leaves at the top there. And a urethral plant on the bottom for superior urethra. These tumors can be sessile or papillary, and tend to be multifocal, hence the multiple foci of cute little hermit cancer crabs. The multifocal nature of urothelial cell carcinoma may be due to the fact that whatever carcinogen is setting this off is likely floating around in the urine and causing a diffuse toxicity that pops up as cancer in multiple spots. There might also be drop metastases that pop off, float around in the urine, and implant proximal or distal to the primary tumor. Weird. On histology, urothelial carcinoma appears similar to the transitional cell epithelium that lines the urinary tract, but hypercellular with more cell layers. You might also notice nuclear hypochromasia and loss of cellular polarity. Thus, we've added more dark, disorganized nuclei to the transitional curtains above the crabs. Occupational exposures to aromatic amines, such as beta-naphthylamine, are important risk factors here. These are prevalent in industries involving rubber, plastic, dyes, leather, and paint. These substances are excreted in the urine, and while they sit in the bladder waiting for urination time, that poor urinary epithelium is bathed in the carcinogenic chemicals. In Western countries, the most common carcinogen associated with the development of urothelial cell carcinoma is cigarette smoke. And lastly, as symbolized by that little Cyclops aquarium decoration, there's cyclophosphamide, an alkylating anti-neoplastic agent used in chemotherapy and treatment of rheumatic disease. The uroprotectant mesna is used in conjunction with cyclophosphamide in order to inactivate the drug metabolite thought to be responsible for both hemorrhagic cystitis and bladder cancer development.